Okay, thank you and good afternoon, everybody, and I hope everyone is having a good week. You may have noticed that we're joining you live here today, a couple of days ahead of schedule, and we've decided to increase our daily briefings really because of the increased activity nationally to the pandemic and just bring a little bit more awareness to the fact that we're really not out of this yet. So we're at a very delicate point right now in the pandemic, and the actions that we take right now are really going to determine the direction that we go into the future. Each one of us has a role to play, and each one of us can contribute to the success that we've had so far in the metropolitan area. So our message to you is to remain focused. We do not want to see the things that are occurring across the country where cases and hospitalizations have dramatically increased happen here. We don't want our numbers to spike again. We've done a lot of great work over the past months. We've sacrificed a lot, and we don't want all of that sacrifice to go to waste. And this is especially true with the holiday weekend coming up and just around the corner. First, though, let's get to our data for today, and then I'll take questions from the media. So here again is the chart showing our hospital admissions, and it continues to show progress. Again, this is a trend of our daily new hospital admissions since early May. Today we report 11 new COVID admissions, which is down from 17 one day prior, and brings our 7-day rolling average down to 17. We're headed back in that downward slope after that slight uptick earlier this week. And again, we're going to see those fluctuations from time to time, but we really want to stay focused on that overall trend, which is that blue line that you see on the graph, and make sure there's not any significant increases over time. And as a reminder, this data is an average of the past 7 days, that blue line is, and has a 2-day time lag on it. Another reminder is that hospital admissions are what we call a lagging indicator. So something has already happened that has caused a patient to become sick enough to be admitted to the hospital. And what that means is there's been some transmission in the community. It's an end result and doesn't really get us far ahead of the curve. That's why we're always concerned whenever we see an increase in admissions, because that means there's some transmission going on in the community. Next, a slide everybody is familiar with is our hospitalization numbers, and those continue to show progress as well. They flattened out quite a bit, but that's okay. Today's rolling average is 230. And today's overall hospital census is also down. Today it's at 212. We want to see those numbers continue to come down, and we want them to stay as low as possible. Now let me update you on our daily numbers. So as you can see, we have 212 hospitalizations today of confirmed COVID and suspected COVID patients. And we have 49 confirmed COVID and suspected COVID patients in our intensive care units, and we have 33 confirmed COVID or suspected COVID patients on ventilators today. Now going forward, we're going to start breaking these numbers out into COVID admissions and then suspected COVID. And the reason for that being is that what we have found over time is a lot of those suspected COVID patients don't actually turn into actual COVID patients. Their tests come back negative. And so we think it would paint a better picture, a more precise picture, for us to break those out into two groups going forward. So we'll start doing that on Monday. And now it's time for our good news slide. Which is our hospital discharges. So our task force healthcare systems discharged 23 additional COVID patients yesterday, bringing our cumulative total to 2,816. And again, that's a big thank you to all of our frontline healthcare workers who have touched these patients' lives and worked so hard to get them better and back home. Now this next slide you've seen a couple of times before, and this is just to reiterate where we are in time. So as you can see, we've come down quite nicely, and we've followed the model that we've first displayed early on in the pandemic. So the question that we all have is this recent uptick in activity in the country something that we should be concerned about? And as you can see, we've come down nicely with our number of inpatient admissions and our ICU admissions. And what we really want to avoid, and what we've talked about before, is avoiding that red line, which is a second wave, as people like to call it, or a bump in admissions. And the way that this model was built was an increased transmission in the community, or that transmission factor that we've talked about in the past. And that's, of course, the line that we want to avoid, and that's what you're seeing in some areas of the country. So next, let me show you a comparison of how St. Louis is performing against some other metro areas. And you may not be able to zero in too much on a lot of these different metropolitan areas, but this is really comparing us to 24 other major U.S. metropolitan statistical areas around the country that are comparable in size to St. Louis, and see how do we compare to them. And so St. Louis, if you can't tell, is on the bottom right-hand corner, the second one from the right. But all the other ones with the major spikes are the areas that you're hearing about in the media now. So for instance, in Texas, the second box on the top is the Austin area's infection rate, and you see a really large spike there. And as I'm sure you've read and heard in the media, the governor now is having to reintroduce measures that previously they had relaxed, such as shutting down bars and things like that. And that's absolutely what we don't want to happen. Charlotte, North Carolina is in the green, just a few boxes over from that, and it too is seeing a large spike in cases. And I'm showing you this just so that you can visualize really the discrepancy between those statistical areas, those large metropolitan areas, in the St. Louis area. And we don't want to see that spike in cases come back. We want to remain on the downward slope. We don't want to have to reintroduce all of those measures that Texas and Florida are now having to do because of that widespread transmission. So again, I want to recognize the progress that the region has made, and it has been really a testament to the people in this community. Now, as I've said many times in the past, St. Louis has a really proud tradition in battling pandemics. And we've made tremendous investments in the community as well, including increased testing, contact tracing, and bringing the most up-to-date medical advances to the bedside. But we can really only realize those benefits if we keep the number of infections manageable. And it can be manageable, and we can continue to enjoy the things that we love to do if we all do our part. So we all have to do those things that we've continuously mentioned: standing 6 feet apart, being socially distant, wearing a mask out in public, washing hands frequently. If you're sick, stay home. Make sure you're cleaning surfaces. All of those things that help prevent transmission in the community. And a second thing out there is really to take an assessment of your individual risk as well. And so if you do fit into a high-risk category, such as elderly, or you have some condition that puts you at risk for infections, make sure you're taking those extra precautions as well. So avoid those high-risk areas, such as populated areas. Make sure you're wearing a mask out in public, all of those other things to really help reduce the risk of transmission out in the community. Now, as I mentioned before, and I'm just going to repeat this, we're having a change in our data reporting. And again, that's to break out our true positive COVID patients, our inpatients, from our suspected positive. And as you can see, this number breaks out like this. And we'll be reporting both of those numbers. And the reason is those suspected COVIDs, majority of them don't convert to true positive cases, and so we just think it's a better representation of actual COVID patients that are in our hospitals. And so we'll start doing that on Monday. To wrap things up, we'll keep a close eye on the data. So we've presented a lot to you today, and hopefully have put this all into context. This is how the country is going. This is how the St. Louis region is going. These are the things that we really need to be focused on. And it's a very delicate time right now for us in the metropolitan area. And we really have to be focused on those things that are going to prevent transmission from occurring, that are going to prevent hospitalizations and prevent death, quite frankly. And so with that, I'll conclude my remarks and take some questions from the media. Thank you.
Since your last briefing, are there any new concerns that spikes in Missouri's rural areas could impact our local hospitals and healthcare systems?
Well, it's always a concern whenever we see spikes in cases. Now, the majority of those cases were in the southwest part of the state earlier this week, and so we don't expect that would impact the St. Louis healthcare systems. Now, if there are increased number of cases in some of those rural areas surrounding the St. Louis metropolitan area, that more than likely will have an impact on the healthcare systems. Just because of patients would most likely flow up into the metropolitan area to be taken care of. And so we're always concerned whenever we see increased number of cases, especially if it impacts the healthcare system's ability to take care of a large number of patients.
We are a week away from the July 4th holiday. It probably won't surprise many if the Lake of the Ozarks and other locations in our area look the same as Memorial Day. Any thoughts on holiday and your hopes for our region?
So my hopes for the region is that everyone will take a look at what is occurring around the country and understand that the virus has not gone away, that there are plenty of individuals that are still out in the population that are susceptible to the virus, and that the risk is not zero for having increased hospitalizations, for people getting sick, all of those other things. And so we all contribute to prevention of the spread of the virus within the community. And so that means taking all of those actions that we're continually asking people to do. Social distancing, wearing masks, keeping your hands clean, all of those things, so that even if you're in a non-high-risk group, you can still protect other people that are in high-risk groups when you do these things. And so it really does take a community effort. And so I would just ask people to be reminded of all of those things as they're going about their activities for the July 4th weekend.
As we live through the hammer and the dance this year, it's clear we are currently dancing out with the various reopenings happening in our area. Illinois reopens indoor dining today. Many in the community are uncomfortable with the amount of people who don't seem to be adhering to the social distancing suggestions. What are you seeing in the community, and are you concerned a spike or surge may be imminent?
Yes, so I do believe that there is some variability in appreciation for all of the measures that we're advising for people to take, whether that's social distancing, wearing masks in public. And so I would just ask that people reevaluate and understand why we're asking people to do these things. And it's really to prevent spread and to protect your neighbors, your loved ones, your grandparents, other people like that. And so my hope is that everybody would take this seriously, regardless of if you're in a more rural area, a more urban area, because it all does add up. Now, anytime that you have more reopening, more ability for people to interact with each other, such as restaurant openings and things like that, you're always going to increase the probability of spread. The way to decrease or to mitigate some of that risk is to continue to do the things that we're advocating for. The mask wearing, social distance, washing hands, all of those things. If we can continue to do those things, we can continue to enjoy the things we like to do, such as going out and enjoying outdoor activities. But it really does take all of us to contribute to this effort.
Can you explain or summarize why the city of St. Louis recently tweaked the way it counts its COVID cases?
I have not heard anything about the tweaking of cases. I did hear about data coming back from the state that had included COVID cases that were actually in St. Louis County but were in the St. Louis City data. And so from what I had heard, they being the city, was going through the data to make sure that the cases were adequately represented as residents of St. Louis City instead of the county. So I think that is what was going on.
As known statewide cases increase, what triggers should leaders in St. Louis and elsewhere watch most closely while weighing questions about whether to institute or reestablish protective orders? Should they consider more than just hospitalization data, and is hospitalization data alone enough to signal when a local outbreak demands a policy response?
Yeah, it's a good question, and there's no simple answer to it. And the reason being is there's no really good metric that says this is the amount of spread that's going on every day in the community. The only way you could really do that is to test every single person every single day to see how much disease is out there in the community. And so we rely on sort of surrogate metrics or other metrics that give us an idea of what is going on. And so we look at a couple of different things, such as the percentage of tests that are positive in our labs, the admissions data, the number of positive cases, and if it's gone up significantly. So there's no one real single metric that that can trigger us to say, well, there's definitely increase going on now. It's really a combination of things for us to pull together to get context to say, is there significant spread? Is it at a point now where we need to make some or recommend some policy changes? So it's a combination of different things that we look at to see or to understand what's going on out in the community.
With states like Florida and Texas closing gathering places like bars amid massive COVID outbreaks, should similar moves be considered or enacted here, and do we risk meeting the same fate just on a delayed basis?
I don't believe we're at that point right now, and it's always it's always a challenge to understand when is the right time to enact some policy decisions, and there's no exact right time. The data that we're seeing right now, we feel fairly confident in that transmission is still under control. The admission rate, as I explained earlier, is still fairly low. And so all of the other metrics that we're seeing, we feel pretty confident that we're in a good spot right now. But what that doesn't translate into is that we should start relaxing. So we need to continue to do the things that we have done so far to prevent transmission, to keep that rate low. So it's not the time to relax, and I know it's a holiday weekend and people like to gather and be outside and stuff like that, and I completely get it. But this is a different year. This is a different holiday season, and we're going to have to be adaptable to it. And that's unfortunate, but that's the environment that we find ourselves in right now. So I don't think that the data support that right now, but we're always concerned about what is the activity going on that we're not realizing right now. Because let's face it, people that are asymptomatic, younger people, don't get tested. And so is there a significant percentage of the population that's not getting tested, that is positive, that is transmitting in the community? We just don't know that, and I don't know if you'll ever know that. So we're always concerned, but right now we feel pretty good with where we are.
Thank you for tuning in. That concludes the list of questions we've received from members of the media prior to today's briefing.